After 70, many seniors believe that more medical checkups mean better health. But new research reveals a surprising truth. Some common tests may actually harm you more than help. Every year, millions of older adults line up for screenings that promise protection. But what if I told you that certain tests could quietly push you closer to unnecessary treatment, surgery, or even new health problems? Recent studies show that up to one-third of all tests in seniors lead to overdiagnosis, causing fear, medication side effects, and even hospital stays that could have been avoided. So in today's video, we're uncovering 5 common health checkups you should think twice about after 70, and what to do instead to stay healthy, safe, and strong. Let's begin with number 5, a test that sounds harmless, but can quietly hurt your quality of life. Checkup Murphy Bone Density Scan. You've probably heard of this one. It's a quick, painless scan that checks how strong your bones are, called a DEXA scan. Sounds helpful, right? But after 70, it often does more harm than good. Here's why. Almost everyone after 70 has lower bone density. It's a natural part of aging, like wrinkles or gray hair. But when the scan shows even a small reduction, many seniors are told they have osteopenia and are prescribed strong bone medications. These drugs can cause painful side effects like jawbone damage, acid reflux, or even digestive inflammation. And studies show that for people over 70, those medications reduce fracture risk by less than 1%. Meanwhile, the side effects are far more common. Let me tell you about Rose, a 76-year-old piano teacher. She had no pain, no history of falls, and walked every day. After a scan showed mild bone loss, her doctor put her on medication. Within months, she developed jaw pain so severe she couldn't play the piano. When she switched to a natural plan, vitamin D, calcium-rich foods, and light resistance exercise, her strength returned, her balance improved, and she never broke a single bone. The truth is, if you're not falling, not breaking bones, and stay active, you don't need medication for mild bone loss. What helps far more is lifestyle, daily movement, strength training, protein, and vitamin D. Don't let a number on a screen scare you into treatment you don't need. Your body can stay strong naturally with movement, sunshine, and real food. Number 4, brain MRI for memory loss. If you've ever felt a little more forgetful lately, misplacing keys, forgetting a word mid-sentence, your first thought might be, is this dementia? And most doctors respond the same way. Let's do a brain scan to be sure. It sounds logical, but after 70, that test can do more harm than good. A brain MRI creates detailed pictures of your brain. But here's the truth few people know. Almost every scan after age 70 shows something. Tiny spots, slight shrinkage, or small white areas. Doctors call these age-related changes. They're normal, not dangerous. But once they appear on a report, fear begins. People start to believe something is wrong with their brain, even when they are thinking, talking, and functioning perfectly well. This fear can trigger more tests, spinal taps, biopsies, even unnecessary treatments, and all of it brings stress, sleepless nights, and anxiety that can actually make memory worse. Let me share George's story. He's 74, a retired engineer, sharp, active, and independent. He started forgetting small things, names where he parked his car. His doctor ordered an MRI, which showed white matter changes. He panicked. He stopped driving, avoided friends, and convinced himself he was losing his mind. But when he came for a cognitive screening, a simple paper test, his memory was completely normal for his age. We worked on sleep, hydration, and brain exercises. Within months, his focus returned, and so did his confidence. The truth is, most mild forgetfulness is not dementia, it's lifestyle. Poor sleep, dehydration, lack of mental challenge, all can mimic memory problems. If you're noticing small lapses, start with a basic cognitive test, not an MRI. It's quick, simple, and doesn't create fear. And if something serious really is happening, it will show up there first. So, before you agree to that scan, ask your doctor, will this result change my treatment, or will it just make me worry more? Because after 70, protecting your peace of mind is just as important as protecting your health. Number 3, the cardiac stress test. It sounds serious, even heroic. Walking on a treadmill while your heart is being tested. Doctors often suggest it when seniors say they feel tired, dizzy, or just not like they used to. The test is designed to check for blocked arteries, but after age 70, it's one of the most overused and misunderstood tests in medicine. Here's the issue. In older adults, stress tests often give false alarms. They show a problem when the heart is actually fine. Studies show that after 70, false positive results happen in nearly 4 out of 10 people. And that single test result can start a dangerous chain reaction. More tests, more dyes, more fear, and sometimes even unnecessary surgeries. Let's look at what happened to Raymond, a 75-year-old retired mailman. He stayed active, walked daily, and just mentioned to his doctor that hills made him tired. The doctor ordered a stress test, just to be safe. The result looked unclear, so they sent him for an angiogram, a procedure where a tube is inserted into the arteries to look for blockages. They found a mild narrowing and placed a stent. That night, Raymond had a reaction to the contrast dye and ended up in the hospital with kidney issues. He stayed there for 6 days. And the fatigue? It never went away, because it wasn't his heart at all. He was just a healthy older man who needed more water and rest. This story is not rare. It's happening every day. If you're over 70 and don't have clear signs of heart disease, like chest pain during exercise, shortness of breath while climbing stairs, or exhaustion that comes suddenly, a stress test may cause more harm than help. A smarter, safer choice? A resting EKG or a coronary calcium scan. Both give your doctor valuable information about your heart without putting you through unnecessary risks. So, before saying yes to that treadmill test, ask, will this test really change my treatment, or will it just worry me? Because protecting your heart isn't only about avoiding heart attacks, it's also about avoiding unnecessary fear. Number 2, colonoscopy after 70. This one surprises many people because colonoscopies are often seen as life-saving. For younger adults, they can be. But after 70, especially after 75, the risks often outweigh the benefits. Here's why. A colonoscopy is not a small procedure. The preparation involves strong laxatives that can cause dehydration, dizziness, and kidney strain. Then comes the sedation, which can temporarily affect memory, balance, and even mood in older adults. And while the procedure itself may sound routine, complications like internal bleeding or intestinal tears are far more common after 70. A large study of over 1 million seniors found that for every 1,000 colonoscopies in adults over 75, only 2 lives were saved, but more than 20 people had serious complications. That's a 10-to-1 risk ratio. And even when small polyps are found, they often grow so slowly that removing them causes more harm than leaving them alone. Let's talk about Dana, a 73-year-old grandmother who ran a small bakery with her daughter. She was healthy, active, with no stomach pain, no bleeding, and no family history of cancer, but her new doctor insisted on a routine colonoscopy. During the procedure, a small polyp was removed. That night, Dana had severe abdominal pain and fainted. She was rushed to the hospital. Her bowel was perforated. 9 days in recovery, 10 pounds lost, and months to regain strength. Later, it turned out, she had already had 2 clear colonoscopies before. There was no reason to repeat it. medical guidelines are clear. Routine colon cancer screening should stop at age 75 for most people. If you're in good health and still want to check, there are safe alternatives, like the FET test, a simple stool test you can do at home. It requires no preparation, no anesthesia, and still detects most serious issues. So, before you agree to another colonoscopy, ask your doctor, have I already been screened before? Do I have symptoms? If not, you may be safer skipping it. Remember, true prevention isn't about endless procedures. It's about smart choices, balanced nutrition, fiber-rich foods, and regular movement. Your gut health starts in your kitchen, not on an operating table. Number 1, full-body CT scans. This one is often sold as the ultimate health check, a modern, high-tech way to find hidden disease before it starts. Private clinics promote it as peace of mind, but for people over 70, it can be the opposite, a doorway to unnecessary fear and harm. A single full-body CT exposes you to a large amount of radiation, equal to around 500 chest X-rays. And that radiation doesn't just disappear. Over time, it can increase the risk of developing cancer, especially in people who have had multiple scans. A recent study found that CT scans may now cause up to 5% of all new cancer cases in the U.S. That's roughly the same as daily alcohol consumption. And yet, there's no evidence that doing these scans just in case actually saves lives. What they do cause, however, are false alarms. Tiny harmless spots or nodules are flagged as abnormal. And that starts a long chain of stress. More scans, more tests, and sometimes unnecessary surgeries. Marcus, an 80-year-old martial arts instructor, went through this. He felt great, energetic, active, and signed up for a full-body scan as part of a senior elite package. The scan found a 3-millimeter nodule in his lung. He was sent for more tests, then a biopsy. The result? Benign. But the biopsy collapsed part of his lung, and he spent 2 months recovering. That's 2 months of pain, anxiety, and hospital visits for something that never needed to be touched. Experts are clear. Full-body CT scans should never be used as a general screening tool in healthy adults. If you have no symptoms, no unexplained pain, no weight loss, no bleeding, you don't need it. A targeted scan for a specific concern is different and useful. But scanning your entire body just to check is like searching for treasure with a landmine detector. You might find something, but the cost could be far greater than the reward. So what's the better way? Listen to your body. Get regular, simple checkups with your primary doctor. Eat nourishing foods. Sleep deeply. Move daily. These habits detect disease earlier than any machine, because you notice the small changes that matter most.